All right, we're into the fast facts about Crohn's, so keep your ears open and your cell phones closed. Let's begin with some numbers. You should know that Crohn's disease is the most common inflammatory bowel disease, with an estimated 112,000 Canadians currently living with the condition, and over 5,000 being diagnosed with it every year. So this is by no means a rare disease. And it's more common in developed countries, with Canada having one of the highest frequencies of Crohn's in the world. We know that your chances of getting Crohn's are affected by your environment, which the previous fast facts imply, as well as by your genetic makeup. As far as when people seem to develop the disease, it usually begins in people in their 20s, so fairly young, and the diagnosis seems to peak at the age of 30. Smoking is an important environmental factor that increases the risk of developing Crohn's disease and makes the disease worse. So if you don't have enough reasons to not smoke, here's another one. Also, inflammatory bowel disease, or IBD, is often confused with irritable bowel syndrome, or IBS, because they share two of the same letters in their names, and some symptoms, such as abdominal pain, cramping, diarrhea, and nausea. But the conditions are not the same, nor are they treated the same way, since IBS doesn't involve inflammation. Speaking of inflammation, let's talk briefly about medications for Crohn's. They can be broken down into treatments that help manage the inflammation in your gut, and those that simply address those inconvenient and irritating symptoms that can make your life such a challenge. You'll likely try a number of each type as you and your healthcare team work to help manage your disease and shorten your relapses, but we'll talk more about those treatments in the section devoted to them. And now, here are some numbers about Crohn's and the hospital. Most patients experience a first hospitalization within 2 years of diagnosis, meaning their symptoms force them to seek more serious care than just medication. Unfortunately, some of those hospital stays may involve surgery. There you have it. Important trivia on Crohn's. Not only do you know more than you may ever have wanted to know about Crohn's, you're also ready to rack up some big points on Jeopardy next time you're on the show. You might want to check out the symptoms of Crohn's, or you could simply return to the menu.